Thank you, everybody, for joining us today. We are about to start a news conference on the temporary COVID-19 TRIPS waiver. We're going to hear from Tulika Singh. She is an MPH candidate. She's with Right to Health Action. She is a PhD candidate. She is an MPH. She's a PhD candidate in virology and vaccinology. And sadly, she has a personal experience about what it means not to have vaccines for the world. Please, Tulika.
Thank you, Lori. It is my honor to speak alongside everybody on this panel. Hi, everybody. As Lori said, I'm completing my PhD in virology and vaccine development and also have a master's in public health. I'm here today on behalf of Right to Health Action. We are a grassroots movement that is 127,000 strong across the country. We are fighting to stop COVID-19 and prevent future pandemics and ensure that everybody has an access to life-saving vaccines now and in the future. Today, I want to tell you a story about my grandmother to tell you why we need to act now to make vaccines available globally. My grandmother raised me. She is just so loving. No matter what mood you're in, my grandmother can always make it better. In every picture, she's smiling. In every video, she's singing. She even sang to the nurses at the hospital. Can you believe it? Especially, I love her big hugs. It's just the best thing ever. It's all around you, and I really miss it. In mid-October last year, my grandmother's oxygen level dropped to dangerous levels. She lives in India. She was rushed to a hospital in Mumbai, India, where she tested positive for COVID-19. From there, she was swept off to another hospital for COVID-19 patients only. She was separated from our family members. She was sick, she was confused, and in a hospital where she couldn't even speak the language. For 19 agonizing days, we waited on every message from the hospital. The lack of information from an overrun hospital was stressful. She didn't deserve this. She raised a big family. Why couldn't we be with her? Day after day, her conditions deteriorated until she was put on the ventilator. She was barely conscious. She had a feeding tube through her nose and machines poked and prodded her arms. The doctors gave her more and more life support interventions. Still, on October 23rd, my grandmother died alone in a hospital in India of COVID-19. I remember that big hug. I can hear her singing in my head. And she is never coming back. I know that there are people out there today who were unable to be there for your loved ones in their last moments because of this virus. We don't want to keep living this nightmare over and over again. We want to be able to protect our families. Few in developing countries are projected to have access to vaccines this year. And if current trends continue, they may not have access until 2024. There are literally billions of impoverished people waiting in line for years while a rapidly mutating virus runs rampant. This pandemic will rage largely unmitigated amongst a significant share of the world's populations, resulting in more deaths. And we risk a vaccine-resistant variant that puts the world back on lockdown. Without sufficient vaccines, just a couple days ago, as the other speakers have mentioned, we saw a record high surge of cases in India, 314,835 new COVID cases in a day. These are not just numbers. These are people's grandparents. They're our brothers, our sisters, our parents, our cousins. These are the people we love. And my 89-year-old grandfather is still there. He continues to be at high risk of COVID and still doesn't have the vaccine. How many days or even years is it going to be till my grandfather in India and everybody's grandparents and families around the world can have access to this life-saving vaccine? When can we all be safe? 48% of all vaccine doses administered so far have gone to just 16% of the world's population living in high-income countries. That is a massive inequality. There is an enormous untapped manufacturing capacity already in countries like India, where my grandmother died. Western pharmaceutical corporations' refusal to issue licenses to qualified manufacturers in Africa, Latin America, and Asia is a major cause of this shortage. The US government granted intellectual property monopolies were never designed to be used in emergencies like pandemics. Perpetuating private monopolies on public research during this time of crisis is immoral. And exceptions have been created in the past to ensure that private monopolies and are not a barrier for public health, such as the exception for penicillin in the Second World War. Without action to share vaccines and vaccine manufacturing technologies, this pandemic will not be over. We simply cannot afford to delay life-saving vaccines and allow this virus to take more lives. So today, on behalf of Right to Health Action and alongside Senators Sanders, Baldwin, Representatives Garcia, Schakowsky, and Blumenauer, as well as NGOs like Oxfam and Partners in Health, I am calling on President Biden to show courage, to join the world again by ending this vaccine apartheid, to keep his promise to Andy Barkan, a man dying of ALS, that patents would never be a barrier for poor countries. Please support this TRIPS waiver and be a leader who saves millions of lives. We need to do something now so we don't have to deal with the pain of losing our loved ones again. President Biden, you are a grandfather too. You have suffered the loss of loved ones just like us. Please show compassion now and share the vaccines with the billions in the world who still need the vaccine, and decisively bring an end to this pandemic so I can also be reunited with my grandfather. Please be the champion that we need to protect our families. Thank you, Lori.
Thank you so much, Tulika. Thank you so much, and everyone's condolences and love, and thank you for that very, very powerful intervention that says it exactly like it is, and is a perfect lead into Senator Bernie Sanders, a guy who on the regular says it exactly like it is and has been doing so since I had the honor of first meeting him during the NAFTA fight when he was a House member and was kicking butts then. And great appreciation to Bernie Sanders for helping to lead the letter of senators calling for the TRIPS waiver. You guys are the perfect 1-2 punch. Please, Senator Bernie Sanders.
Ending this pandemic requires collaboration, solidarity, and empathy. It requires a different mindset. That's the issue here, a different mindset. And it's a mindset that tells the pharmaceutical industry that saving perhaps millions of lives is more important than protecting their already excessive profits. You know, I don't think this is a hard discussion. If the question is more profits for the drug companies or saving God knows how many lives, the answer is pretty simple. Further, and this point has been previously made, you know, our government, the United States government, our taxpayers have invested enormous sums of money into the production of these technologies. And as a result of those investments, all people in America and around the world should benefit from that investment, and it should not just go to a handful of very profitable drug companies from wealthy countries. Transferring these life-saving technologies, by the way, is not just about responding to this pandemic. It's about preparing for the next one. And we know the next pandemic is not a matter of if, but when. And experts have recently been sounding the alarm that low vaccine coverage enables the growth and spread of vaccine-resistant mutations. This isn't just about showing global solidarity, as important as that is. It is in our own direct interest to help vaccinate as many people as possible, as quickly as possible, to prevent the spread of virus mutations that could come back to the United States and force us to shut down again. So once again, on this enormously important health issue, this moral issue, the United States has got to do the right thing